Right. Let's have a look at the other questions. So these next ones are in treatment questions, not to do with once the treatment's been done. Is it painful? Hear that all the time. Is the treatment painful? What would you say? Like, I've never had a lip treatment done, unfortunately, but you may well have done. So what would you say about the pain if somebody asked you about how painful it is?
I always say that it's one of them things that it's you put in a needle, you're putting something sharp into a very, very sensitive area of your face. So it's not going to be an absolute walk in the park. What I would say is we do use a very strong numbing prescription numbing cream, which does make the treatment a lot more comfortable. Obviously, as experienced injectors as well, we will try and minimize the discomfort, because we're not slow. I always think that some people can really take the time when they're having the lips done and really make it quite a painful experience. But I'm not suggesting that we rush or jab and snap and things like that, but with more experience you do get a bit quicker to get the results that you want to try and achieve. So I always tell them it's probably going to nip a bit. It all depends on people's threshold as well, the pain threshold. I find some people don't blink an eyelid. A lot of people just get really worried and worked up when it's the first time, but once they're actually into it, they're like, oh, it's fine, it really wasn't that bad. And most people, to be fair, will say it wasn't as bad as what I imagined. For most people, it's the first time and it's the unknown for most people. You get, when they come back for the second and third time, they just walk into it and they're not concerned or worried at all. They know they're in good hands. The numbing cream is very good. It really does help. And obviously, if they want a break and they want a minute, they can have it.
That's fine. I tend to use ice as well a little bit just before starting injections, because the ice helps to reduce the sensitivity, makes it less sensitive, the area, and it reduces bleeding as well. So I tend to use a little bit of ice compression just to make the whole process a little more bearable.
Definitely helps,
Okay, I'll get that next one up. Let's have a look. Scared of needles, can you help? As you said, it's really about gaining trust in the practitioner doing the work. After the first time, I tend to see clients without any problems with nervousness. They tend to be quite happier than they were the first time, but it's always tricky that very first occasion when you don't know what to expect. So anything you can do to make them feel more comfortable, play music, just let them lie back, just listen to them basically before you start. I tend to find them feeling much more comfortable after that first treatment. There's some clients I have, they've been scared of going to the dentist before they've come to have lip treatment, and they've needed sedation before going to the dentists, with diazepam. And I've carried out some work, not lip treatment, but other work, filler treatments. And this one particular lady, after she had 2 rounds of marionette line treatment under the mouth, she's no longer worried about going to the dentist. She's far happier with dental work now. She's no longer needs sedation. She can go there without any problems. So as healthcare professionals, we can try and be careful about the way we do things, and we're able to, you can speak to us, if you're worried about things, you can always speak to us before we do anything for you, which I think is the best way forward for all clients. Treat them with respect and listen to what they've got to say.
Yeah, definitely, I'd agree. I mean, I do get quite a lot of people that are needle phobic, but they get through it absolutely fine. You just got to be patient with them, and not rush them, really, I think. I've only just had one girl fairly recently, really, obviously before we closed due to COVID, but I just refused to treat her because every time I came near her with the needle, she started to sweat and she started to shake, and no amount of patience in the world you know, would have made her feel better. So in the end, it was my decision to say, look, I'm sorry, I don't feel this is suitable for you. I'm not prepared to put you through this. It didn't feel ethical. It didn't feel right. So in the end, I didn't treat her, and you know, she left the clinic without being treated. But sometimes people just can't do it, and it's not our place to force somebody. But generally, most people are absolutely fine with it. I even have some people who don't like the anaesthetic, and they just want to be able to have the treatment because they're not bothered. God knows how, but they do it. But so some people actually enjoy the sensation.
It's just that it's being, as I say, being healthcare professionals, people can always talk to us and tell us what they think and whether they're worried about something or not. We can always put their minds at ease, and I think in that way they're more likely to trust us, you know, with treatments in the future. So okay, that's great. Let me just get the next one up. What's the best filler? I'm sure you get asked that all the time.
What do you say to that one?
What would I say? I'd say it depends on the individual. There's no one filler for me that does everything. There's so many different fillers around, and they're not all the same. There's Juvederm, there's T-Sil, there's Restylane, there's Revelax. There must be about 20, 30, 40, 50 maybe fillers around that we can all use without any problems. And they aren't all the same. They all include the same type of ingredient, most of them high hyaluronic acid, which is the filler. But they vary in how thick they are and how long they last, in what they can do to the lip. Some are for volume, some are for more shaping. And it's affected by someone's age. You know, clients are not all in the 20s. You get women that are in the 40s and 50s. And fillers for them aren't going to be as effective and won't work the same way as they would for someone in their 20s. So there isn't one, for me, there isn't one best filler for everyone. Everyone needs their own filler based on what they're after. So for me, I use fillers based on what the need is. I don't think of fillers as being better than others. They're just different. That's how I see them. What do you think?
I feel the same, actually. I don't feel that fillers are a one size fits all. I see many practitioners that will just stick to one brand, or I'll get somebody in particular that says, I want this brand because my friend has it and her lips are amazing. That might not necessarily work amazing on her. So I do stock a very, very wide range. I do stock the premium fillers, but I will always tailor what filler I want to use to the patient and to what their desires are and whether I can achieve it. So if I get a mature lady who comes in with very, very thin lips and very, very fine lines, I'm not about to use a filler that's very, very thick, that will alter her lip shape and make her look silly. So I would choose to use something a lot softer, and that will be how I make my choice. If you have a young girl who comes in who's naturally got quite big lips, but for whatever reason she wants them enhancing, you wouldn't necessarily choose a very, very soft, fine filler on her because she's not going to see any difference. She's likely to walk out disappointed. So you might want to think about using something a little bit thicker so that she gets the amount of volume that she needs. There is a big misconception that if you've got really big lips, I just need 0.5 and that'll be fine. That's not the case. It's actually the opposite way. So you would need something a little bit thicker to give her the result that she wants. So there is no one size fits all.
That's what I'd say. But I'd say also the types of practitioners that only ever use one filler, a lot of their techniques and their abilities boils down to their training. You know, if they haven't gone through the types of training that we have, they may well not have any idea about what filler to use and how suitable it would be for someone in particular. So if someone only ever uses one filler for everyone, I'd be wary of that. I'd think, you know, do they actually know what they're doing? That's me personally.
Yeah, I think some people are just trained in one, and that's all they think that they can use.
Yeah.
So, but yeah, venture out into different training places, and see and try different fillers, and see what you like. I'm sure you have your preferences of what ones that you like injecting and ones that you enjoy working with, and I'm the same. I do tend to stick to the ones that I know are really easy to inject, because you're likely to get better results than a filler that you're going to struggle to get out of the syringe through the needle. So yeah, I think it's important that you get a practitioner that is able to, again, think outside the box of just like, this is what I stock, this is what I've got, I'm going to have to just use what I've got here. Yeah.
Okay, great. I'll get the next one up. Let's see. Which lip filler techniques do you use? I'm guessing this is one of our competitors has probably asked us this, Claire. So what would you say to that?
I use a wide range of techniques. I don't just use one technique on everybody, because we're all so different. People want different things and need different things. So you might get a patient that particularly just needs height on their lips, or they'll come in and they'll say, I don't want a duck trout pout. They don't want the projection of the lip, but what they want is the height of the lip. That would instantly tell me, well, this is a certain technique that I need to use rather than another technique. There's all sorts of different techniques and weird and wonderful things you can do on the lips, but yeah, there are people out there that simply just do what they've been trained, and that's fine, because they shouldn't do things they're not trained on. But obviously the more training and the more experience you've had, then you're likely to put all those different skills into every one of your patients, and to be able to offer them different things that you might not be able to when, say, for example, you first started out. For example, asymmetry. It's something that I never promise that I can correct, because again, I don't want to over deliver and make somebody think that I'm going to do something that I can't. But there are certain techniques that you can try and can use to correct or help improve asymmetry. But there'd only be a few techniques that could do that. So obviously, again, that's down to experience and a wide range of using different techniques to try and do that.
Yeah, that's fine. Great. You've actually covered those questions for the in-lip treatment, the questions that we'd got. So I'll go to the next ones. Post-treatment questions. So these are questions we got asked following treatment. So what is the recovery time? What do you tend to say to clients about that, Claire?
I always say to them, on average, sort of 24 to 48 hours is where you get the most significant amount of swelling. And ultimately, I usually say as well that we never truly see the end result till about 2 weeks. So if somebody was going to a wedding or a really important function, then I would always say give it a few weeks before it's something important like that. If you're going to have photographs taken, have people looking at you, etc., etc. But if some people are not so concerned about the swelling, so if they're not concerned, I usually just say sort of 3 to 4 days is where you see the most drastic results. So that's where you get the most amount of swelling. If you're going to get any bruising as well, then obviously that's going to be apparent. So generally I say 2 weeks for the end results, for everything to fully settle, and that's the swelling, that's the bruising. Also, some people will swell more on one side than the other as well. So somebody may feel, oh, I feel like you've put a bit more in one side than the other. Again, we always say to people, give it a couple of weeks to fully settle, because sometimes there might have just been a little bit more trauma on that side than the other. We don't really sort of revisit that until a couple of weeks after, when we know that the lip has fully settled.
Okay. So I'll look at the next one. You've covered that a little bit already. How big
Oh
do
yeah,
lips get with a
how
swelling?
big will my lips get?
I work weekdays. It's just like you see different clients with different amounts of swelling over the next few days. You get a message like the following day, oh, my lips are just huge. And when clients are lying down, you get some fluid retention, because they're asleep and they're lying on the back. And that tends to drain away within a day or so. I don't tend to see many problems after that.
No.
But with working weekdays, I suppose I tend to sometimes treat clients on a Friday evening or a Saturday morning, and it gives them a bit of time to recover over a couple of days before they go back to work. So that's the type of advice I'd give to clients like that. I'm guessing
Yeah.
you're the same.
Definitely. I definitely get the most amount of swelling in the first couple of days, but that's generally gone by a couple of days.
Yeah.
Like you say, the morning after is usually the worst, with laying down and gravity, but we often find that by the time it's come to the end of the day and they've been moving about and got everything, the lymphatic system and everything going again, usually the swelling has subsided pretty dramatically by then.
Yeah.
That there are lots of girls that love the post-treatment swell, and sadly it does go, but some people it can be quite frightening when they see it the next day, and that's something that I will always explain really well. If you're living with somebody or they don't know you had your lips done, they wake up next to you the next day and they're huge, you're going to have to tell them that it's just swelling and that it will go. I've even had a couple of girls message me saying, I haven't swollen, is there something wrong? So that just goes to show how everybody is really different where the swelling's concerned. Some people just won't swell that badly, and then you'll get others that, can really, really swell.
Yeah. For me, it tends to be most prominent the first time a treatment's carried out because the body's never got used to the filler. It's never had the filler there before. So I tend to see more swelling on the client's first treatment, assuming they use the same filler the second time. I'm guessing might be similar for you too. You might see most on that first occasion.
I've never really thought about it really. What I do notice is I think if you have your treatment quite late on at night as well, it's often worse the next day. Yeah.
Okay. Let's have a look. How long will it last? I'm guessing that means how long will the filler last overall? I suppose it depends on, the filler that's used, the actual person getting the treatment, things like medication, medical history. You can have different breakdown speeds of the filler over time for different people. Generally, I tend to say 6 months is like an average time. It can be quite a lot longer. It can be quite a lot less. What do you tend to say for most of your clients about how long it will last?
When it comes to lip filler, I usually say anywhere on average 4 to 6 months when it's your first time. Yeah. That's just an average figure, because obviously everybody's metabolically different.
Yeah.
I do cover things that might break down the filler a little bit quickly than in one person and not another. Yeah. I will also advise that if it's the first time, you're not likely to get a huge amount of volume as well from the filler, so it might not be particularly noticeable to them when it's the first time, because we spend a lot of that first time shaping, creating the definition, and basically just putting the foundation down. So it's usually the second treatment that most people notice the amount of volume that they get. People very quickly get used to seeing themselves with filler as well. So it's fairly common to think after 3 or 4 months, oh, the filler's gone, I want to book in again. And obviously when they come to the clinic, it's still very apparent that they've still got filler in there. But they just get very used to seeing themselves. So generally 4 to 6 months, I say, especially for the first time. Obviously the lips it's a very metabolically active area. Mouth's always on the go. So it is going to break down quicker than, say, for example, they have it done in the cheeks or the nose, where the filler can stay put for quite a long time. Okay. So I usually advise that, and then if it is somebody who is wanting to build up volume, then I will advise a treatment probably in about 8 weeks. Yeah, that's when they notice the more noticeable difference if they are trying to build up a little bit of volume.
Great. Okay. You've covered some of this already. What are the main issues I can expect after treatment, and what can I do to help? I tend to give aftercare info, to clients, just so they know what to expect and what they can do. As you've said, swelling, it's always a problem for the first few days in particular. Minor risk of bruising. You always get clients that are worried about a little bit of bruising that appears after a day or two. I tend to suggest, using arnica, just using a small amount of arnica cream or gel to apply around the area. It just helps to minimize the bruising worsening over a couple of days. Is there anything you'd say about that, Claire?
I always I recommend pineapple juice as well.
Which is pineapple juice.
Yeah, it's a natural way of helping with the swelling. So that does help a lot for people that might not want to take tablets or anything. But arnica is a big one for me. I do actually sell a little pot of Zoe Balm, which does contain arnica in it for the post-treatment swelling and bruising, and I really, really like that. So I do promote arnica, definitely. Yeah.
Okay, great. Let's have a look. What else? What happens if something goes wrong or I don't like how my lips look afterwards? I don't tend to have too many problems like this. I'm sure you don't either, but I get clients who actually come to me having had this problem from being treated elsewhere. So what would you say to someone about whether, something needs to be done after a treatment's been carried out? What would you tend to say about that?
If I'd carried it out.
If you, or generally in your own experience, your problems tend to be problems from somewhere else that you're fixing, I'm guessing. I don't think your problems are caused by you directly. I think most of your problems, and mine definitely, are problems from other people having been treated elsewhere. But whether it's yours or someone else's work, what would you say to them? What would you say if they had a problem?
If somebody came to me with a problem with their lips that somebody else had treated, I would be very cautious about retreating them and adding to the problem. So I feel that if people come with existing lumps, bumps, asymmetry, overfilled, anything like that, then I do advise that we start again. And I would suggest dissolving the previous filler before I start with anything. I'm not about to add on to more treacherous work that I sometimes see. If I created a problem, and I'm not going to lie, sometimes things do happen. Sometimes people do get lumps. It might not be a fault of my own, but it can happen. Then obviously I would do everything I could to rectify it, whatever that may be. Doesn't necessarily mean that you've got to have your lips dissolved. There are other things that we can do. But definitely I won't just add on to other people's work. I think if they've got lumps and bumps and things like that, you're only going to make it worse. People do say to me as well, oh, what if I don't like my treatment? Is there anything you can do? Yes, at the end of the day, if you really, really dislike it, then that there is dissolving option. But it's certainly not something you would just do willy-nilly. You would just obviously say to them, it's very unlikely you're not going to like the treatment. And most people, to be fair, it might just be a little bit of panic when they see the swelling, because instantly it's like, oh, they're probably just a little bit bigger than what I wanted. But that's, you've obviously got to reassure them then that it's swelling, it will go down, and luckily I've not had any issues yet. I've not had to dissolve my work.
No, same thing. There was just that next question was about when can it be done in terms of dissolution and reversing the problem. Most of the clients I see, well, all of the ones I tend to see are problems with botched treatments done elsewhere, and they'll need reversing and starting again. And I tend to see them maybe a few months after they've had that treatment done elsewhere. So for me, reversal can be done at any point, but it's difficult to guarantee the outcome of that. It doesn't always work, or it doesn't work in one go. So what do you tend to say to them? And also there's the issue of, you know, some clients just aren't suitable for it. They can have problems during a patch test, which we're supposed to do with the treatment before we start dissolving. We're supposed to check to make sure that it's not going to cause a problem for them. What would you say to someone like that in terms of timing? You know, when can they have a treatment done, and would it be beneficial if they wanted reversal doing?
I'm like you. I'll always patch test. I patch test everybody. I know there are some arguments about whether you should or you shouldn't, but I always want to make sure that I've covered all bases and done everything I possibly can, really, to ensure that you know, I am trying to minimise risk for people. If I'm dissolving work myself, I do explain to people, especially if they have been elsewhere, if they don't know what filler is in their lips, it doesn't always dissolve first time. There are some poor people out there as well that are told, oh, this is what you've got, because they like them to think that they're using a premium brand, where clearly they haven't got that particular brand in, and it's something that might be a little bit more cheaper or more difficult to get rid of. There are some fillers that really do stay put and we struggle to dissolve, and I have had a number of ladies that have taken 3 or 4 attempts to fully get rid of it, because of the work done by previous practitioners, and we've just no idea what was in there. So we do have to warn people of that, because it's very common. I want my lips dissolving. I'm going on holiday in 2 weeks. I want you to make them right before I go away. You know, it's really important for us to say that that might not happen. You might come back to me in 2 weeks and you might not have, you know, you might still have filler in there. It might not have all gone. So we do have to advise people that they may need a series of treatments before we can get round to, you know, ultimately redoing them and getting them back to a better place.
Okay, great. There was another question going on from that. Had my lips done elsewhere, hate them, but the nurse won't dissolve them. Whoever's actually done them, I'm guessing the mean. Why? Well, for me, well, for you as well, the dissolution involves a prescription medication item, which can only be prescribed by a prescriber. So if someone else can't do it for whatever reason, it might be because they aren't a prescriber or they aren't trained to do it. Have you had questions like that from other people asking you why someone else wasn't able to do the dissolution for them, Claire?
Yeah, I had a couple of times. I think I have come across it where people have, I think they've just been probably fobbed off more than anything. I don't know whether it was another nurse or a non-medic, but some people just don't like to take responsibility for maybe causing a problem. So I have had instances where people have contacted me and they've said I've asked them to dissolve and they won't do it for whatever reason. That's not really my place to go delving into why they won't do it. So I never really get to the bottom of why. I can only assume that they don't want to either take the risk, or they're not prescribers, or you know, there's some other reason why they won't do it. It might be a confidence thing. Some people are very worried about dissolving lips because we're taught to do it in emergency, but not everybody chooses to do it electively because there are risks associated with it. So possibly that might be a reason why they don't want to do it. They might have had a bad experience with allergic reaction before. I don't know, but I know when I do it, I always do everything I can to minimise risk, and I've got any doubt whatsoever, I won't do it.
Okay, that's fine. Another question: if you've had lip fillers for a while, then decide to stop, do they go back to normal? I've most of the clients, well, I don't know any clients that haven't carried on with treatment actually, so it's difficult to say from experience, but it depends depends on the treatments that are being carried out, I'm guessing. If the fillers have been used extensively, large volume treatments have been used ongoing, there's a risk the actual the tissue can stretch, the actual lip tissue can stretch a little bit. And if it stretches excessively for a long period of time, there's a risk that that will become floppy should the actual filler volume gradually drop down to nothing. There's always going to be some filler there over a long period of time, but if it drops down significantly, I'm guessing there is a risk that the actual lips can end up looking a little bit floppy. Have you ever come across any clients like that have stopped after a long period of time?
I can't say that I have, but I have come across a lady who came to me with, she actually booked in to have her lips dissolved because she'd been to another practitioner. She wasn't happy with the outcome. She had a lump, and they did actually dissolve it for her. But when she came to me, she felt like there was still some filler present in her lip that had not fully gone, because she had this quite noticeable marked area on her lip, which you could look at her on face value and just think, yeah, that's a lump. Yeah. But when she actually booked in for the consultation, it wasn't a lump of filler, it was a loose part of excess skin. Yeah. And that's where the lump was in the first place, that had been dissolved, and unfortunately it had stretched. Whether or not it was some scar tissue or fibrosis underneath, fibrosed tissue, sorry. But it was very, very obvious. Yeah. And unfortunately, she needed referring to a plastic surgeon in the end, because it made her so miserable. Yeah. And there was nothing I could do to help her or make her better. By introducing more filler would have made it more noticeable. Yeah. There was nothing to dissolve. So unfortunately, she did have to go down the plastics route. The other thing that I do see, and I always call it the curtain look. I don't know if you're aware of that. Yeah. But yeah. If it's when you see people that have had filler injected, or the filler has gone into the wet dry border, so underneath where the lip rests on the teeth, yeah. You might have somebody that says, I've not had any filler for 10 years. In fact, I came across it at Julie Horn's training in Oslo. Yeah. And this lady had not had filler for 10 years. All the models there had to be filler free or not had filler for a long time. Yeah. And this particular model came in and said, I've not had filler for 10 years. But as we sort of peeled the lip back like we always do, I always examine people's lips on the inside, outside, obviously, see if we can see any arteries and things like that. There was a whole heap of filler sat underneath. And that was still there 10 years later. Yeah. So yes, it can leave problems, and no, they're not necessarily always going to go back to how they were. It very much depends on the placement of the filler, I guess, and where it was either injected or where it's landed in its time. Potentially, yes, you can have problems.
I suppose being professionals, healthcare professionals, that we'd be advised to, refer if we can't do something ourselves, which isn't something someone else may do. They may say yes to a client irrespective of whether they can actually do the work or not. And I think one of the differences between someone that is trained well and someone that isn't trained well is them knowing when to say no, because you can't do everything. Nobody can. And you need to rely on specialists to do a particular type of work should there be a need for it. So I'm guessing someone that will always say yes to a client is maybe not the best person to go to if there's a problem.
Yeah, definitely. Wholeheartedly agree with that one. Okay. Yeah. I don't think there's any, I don't think there's, trying to think the right word, what to say. There's no shame in saying I can't do that. Yeah. It's not something I can help you with, or not something I can do, but I do know somebody who possibly can. Yeah. So I think with the contacts that we have as healthcare practitioners, we can always reach out to somebody and say, can you help this lady? She's got X, Y, and Z. Yeah. So yeah, definitely no harm in trying. Just got to be able to admit your own limitations, I think.
Yeah. Okay, let's go to this next question. We're almost done, Claire, don't worry, we're almost done. does filler always eventually migrate, and does massaging affect this? I think that was one of your followers that asked that question. It were migration. What do you think about migration? You know, people will be wondering what's migration. You can describe it in terms of duck lips sometimes, can't you? In terms of where the filler is. Do you see a lot of problems with clients? I don't think it'll be your own clients. I'm guessing a lot of these will be clients that have come to you from somewhere else. What would you say to them about migration and the look that they have with their lips to do with filler migration? What would you say about that?
I do try and encourage anybody who might come to me who's been elsewhere for lip filler, and I might not know what's in their lips, especially if they're booking for more. And if they do present with the obvious migration, which is obviously the white area around here starts to look very thick and very puffy. It's very, very noticeable when they purse their lips together as well. It's a very, very unnatural look. So if they're actually coming to me for more, I will always discuss what's happened, why they look like they do, in the nicest possible way, of course. And I will turn people away, because at the end of the day, it will make it worse. And they're walking around that I've just done their lips and it looks like I've been treating them for years and years on end, and I don't want that either. So I'll always advise them to either stop and let it take its course, or I will suggest starting all over again, and I have done quite a lot of that. So you tend to find with migration that it's people that have had treatments with the wrong type of filler. It's probably been too thick for them, for their lip tissue at the time. They may have had too many treatments in a very quick succession. They may have been striving to get really big lips. Unfortunately, it can be quite addictive for some people, and they just strive to get more and more and getting as much as they can. So eventually your lips are a very small space. Eventually that filler is going to come out of your lip tissue. It's got nowhere else for it to go. And that's why you get the migration. And it's really not a nice look. It can almost make you look like you've got a mustache. And when you've got a flash on a camera as well, when they're taking the selfies, that's when it's the most noticeable. And I tend to find that's when a lot of them do tend to start noticing it then. I had a couple of women fairly recently who were getting married, and as they were having their trial makeup, because the lights were so bright on the makeup artist mirror, they were like, "Oh, what's that on my lip?" And they were, so I ended up having to sort of retreat them before the wedding, because that's what had happened. So
right, fine. I think there was one more. Let me just see if there was one last question. Do fillers build up over treatments so last longer? I think it's a question of, it depends on different things, same factors as we've talked about before. Individuals, the actual fillers can make a big difference in terms of how long they last. Certain thickness, certain fillers vary in how long they last, because they're made differently. And you could say thicker. It's a simple description of them. The thicker the filler, the more longer it's likely to last. That's in a basic way of describing it. But certain fillers, you've got a good idea of how quickly they'll break down because of experience more than anything. And when you treat certain types of patients with that particular filler, you've got a good idea of how long you think it's going to last under normal circumstances. But there's things like alcohol, smoking, high intensity exercise. All those things affect how long the filler's going to last. So what would you say in terms of that question, if someone was going to say, they've got a certain filler and they've used it successively for a number of times, do you think it's going to just last longer and longer each time they get it done? What would you say to them?
I do see some people that have their lips done, and they come back a year later and it's still there. So it does last in some people. what I do tend to find in most people, the best way to start on a lip filler journey is to have your first treatment, which is all about your shaping, and I tell them not to expect volume, so that's where we do shaping, definition, try and get the shape that we're trying to achieve, and then I'll usually invite them back in about 8 weeks to actually add the volume. I tend to find if we do it that way, I probably don't need to see them for another sort of 6 to 8 months at least. You will get the odd one if they've got very small lips, or need a bit more work doing for whatever reason. You will get the odd one that might need to come back again. But generally I do find with filler that you can build upon it. It's almost like if you're layering it on, so your first visit is your first layer. I always use the analogy of building a brick wall, I suppose. I say to them, today for your first treatment, you're here for the foundation. You can't start a building, can't build a block of flats without foundations. That's what you're here for. And then obviously, if you desire more volume, or we need a bit more projection or whatever, then we will obviously build up on that. So I do find that, yes, that you can build up on filler, definitely. Yeah.
Okay, I think that's all of them, Claire. We've actually gone through all of the questions, so we've done everything. Is there anything else you wanted to say at all about lip filler treatments generally, or anything you think clients would be worried about that we haven't covered? I think we've pretty much covered everything already.
I think we've bored them to death.
Yeah. The thing is, we always get questions all the time about lips, so I'm sure there'll be things that we'll get questions about individually. I'll get questions about things that I've not said, and you will, I'm sure. But I think ultimately I'd say if you trust the person doing the work for you, and you've been happy with the work that they've done for you previously, stick with them. If you're not happy, go somewhere else. It's a question of what you want at the end of the day. If you aren't happy with the lips that you've got as a result of work that someone else has done, then there's people like me and you who can sort problems out to an extent, and we can help them get hopefully what they're after. But we need to know what they want, and we have to explain whether we can do that and how we can do it. It's always difficult because everyone's different, but if they trust you, I think they're more likely to listen to you and be less worried about what you're going to do and how you're going to do it. That's what my experience has been about doing these things. But
I know. Sorry, go on.
No, just trust. Basically, I just think trust's important.
Definitely, yeah. It's your face at the end of the day, so most definitely, yeah. Another thing that has just come to me that I do get asked a lot is, do I need a separate consultation before having my lips done? No, you don't necessarily need one, but there are some people, if it's the first time, they want to check out the clinic, they want to check out the injector, they want to see if they can build up a rapport with you, want to know a little bit more about the information, what the treatment entails. So if you do want a separate one, people are always very welcome to do that, but you don't necessarily need one, because we do offer a full consultation as part of your appointment anyway. So whenever coming to my clinic, they'll have completed a consultation form, a consent form. We go through risks, side effects, what to expect, treatment plan, what they want, what I can do, and that forms a huge part of the appointment anyway. The injecting is actually the smallest part of the appointment, really. So you don't need one, but you're very, very welcome to come and meet me, or one of the other practitioners that works in my team, if you prefer.
Great. Okay, I think we've covered everything. I don't think there's anything else we've got left to do. I was going to say at some point in the future we'll probably be working together to train other practitioners, I think, in lip augmentation. I think the COVID scenario. Sorry, what was that?
It's in the pipeline.
It's in the pipeline, yeah. I think you're busy with leads now, aren't you? So I think that might take up some of your time for a while. But hopefully, it's something I think we've been thinking about for a while, because we both get questions from other healthcare practitioners about providing lip augmentation training to other professionals. So I think it's something we're looking at, and we'll probably be providing more info about that over the next few months. But we'll see how things go anyway. But thanks for that, Claire, and thanks a lot for,
Thank you.
for taking part. I'll probably think of a few other ideas for videos if you want to be involved in them. So I'll let you know. But hopefully all our followers will enjoy that, and they can always ask us questions that we haven't covered if they want to anyway. So thanks a lot for doing all that. And I'll see you again soon, Claire.
Okay. Thank you. Bye.